Welcome back to our final day of the conference. It may be the last day, but we're ending strong. We've got great stuff going on today. We have an opening session with Dr. Sage Bolte, who's talking about relationships, intimacy, and sexuality after a cancer diagnosis. We hear again and again that women want this information, but often don't talk to their doctors about it. We also have terrific breakout sessions on managing your work life with cancer, what's new in immunotherapy for ovarian cancer, improving ovarian cancer risk prediction, among many others. And don't miss our closing session, in which actor and ovarian cancer advocate Patrick Dempsey, who many of you may know from the award-winning TV show Grey's Anatomy, will talk to us about his devotion to our cause. Have a great day, and I'll see you soon.
Hello, and thank you for joining us for Sexuality and Intimacy After Cancer. In this session, we will discuss the impact cancer and its treatments have on the sexual function, body image, and intimacy, and explore ways to improve each of these. Our speaker for this session is Dr. Sage Bolte. Dr. Bolte is Chief Philanthropy Officer and President of the Inova Health Foundation. She joined Inova over 15 years ago as an oncology counselor and most recently served as Executive Director of Life with Cancer and Patient Experience for the Inova Shar Cancer Institute. You can view her full bio in the downloadable conference program. Thank you so much for joining us, Dr. Bolte. I'll turn it over to you now.
It's so wonderful being with you all today, although virtually and different than we expected. I'm so glad to talk to you today about sexuality and intimacy after cancer. We will be exploring what the sexual self is, how we talk about our own sexual bodies during and after cancer, to look at some of the changes and expectations that most people experience, to look at the impact that cancer and its treatments have on the sexual function, on body image, and on intimacy and relationships, and to further explore ways to improve each of these super important aspects of the sexual self. We know that cancer changes life. Right? We all are different after a cancer diagnosis, and life is often different after a cancer diagnosis. And sometimes I think we put this additional pressure on ourselves to just roll with it, or to say we have to be okay with it, or get over it, stop complaining. And you know what? It's really okay to not be okay. It's really okay to not be okay with the fact that life is different and that your body is different now. And there's also a wonderful opportunity to re-explore some of the things that your body can do, but we really need to give time to grieve what we've lost, to grieve what we've gained, and to give time to redefine what might life look like now and in the future in our own bodies and our relationships, and look forward to accepting what will come, even if it is different than what we had anticipated. I think sometimes we get caught up when we think about our sexual selves, our sexual bodies, especially with a cancer diagnosis like ovarian cancer, that is so personal, that we think that because the changes in our body have affected our sex organ, that things ultimately have to change, or they're going to be so different. And even just that pure definition of sex gets distorted, especially in our culture, that often it gets put on this idea of just intercourse. But sex, and as we'll talk about, sexual self, is so much more than that, right? There often needs to be closeness and connectedness. As we age in general, prioritizing intimacy and sex becomes a real thing, a priority, because if we don't, children get in the way, grandchildren get in the way, jobs get in the way, activities get in the way. And when we're tired and fatigued, unless we prioritize intimate time with ourselves or our partners, it just kind of gets pushed to the wayside. And then remembering one another in the midst of that, right? Remembering who we are at our core rather than just the focus on the sexual activity. And certainly it's so important when we're in a relationship, if it's a sexual relationship, to make sure that we make each other feel like we matter, like we're important to one another. When we think about the sexual self, it's a concept that I explored during my dissertation. And I wanted to think from a cognitive behavioral theoretical view as a CBT therapist, right? What we think influences how we feel, which then influences how we behave. So how does a cancer diagnosis influence the way we think about our sexual bodies. And we have to realize that we come to cancer with a whole host of history, right? Some of us may have had a lot of self-confidence. Some of us might have had a sexual trauma in our past. Some of us might have had really rough relationships or really great relationships. And all of that often influences the way we work through the changes in our sexual self brought to us by cancer. We might have that initial thought, like, I can get through this, I'm capable, which then allows us to feel like we can adapt to some of the changes, to get creative with our makeup, to get creative with how we wear a wig or how we cover our scars, to feeling confident in the fact that our body has changed and we're going to have to get creative on how we interact with our body sexually or our partner sexually. And we don't withdraw. Right? So that external event can influence the way we feel about our bodies and then the way we behave. But if we come at it with, I'm broken, I'm scarred, nothing will ever be the same, I'll never be good enough, or I won't be as beautiful, that esteem, that depression, that anxiety that so many can feel, then influences the behaviors of withdraw. Maybe you're not trying to make yourself feel pretty or sexy. Maybe you find yourself feeling more sluggish. And that behavior certainly is going to influence how confident you feel or how you interact with yourself or a partner sexually. We know that there is a direct correlation between an ovarian cancer diagnosis and sexual function, right? Beyond an ovarectomy, certainly the chemotherapies and radiation, a radical hysterectomy, any of the surgeries that you might have certainly can change our sexual function, from changes in libido or desire, the interest in being sexually intimate, the changes in relationships because you might have to get creative in your sexual relationship, or if you're dating, conversations about the fact that you have had or have this cancer diagnosis and what that means for your body, what that means for your future, and what that means in the present. Certainly, we know that impaired sexual arousal can be caused by either hormonal depletion because of the removal of the ovaries, hormonal suppression or depletion because of medications like Lupron or chemotherapy. There are changes in blood flow that can affect the tissue or the clitoral sensitivity or the vaginal strength. We know that menopause often impairs sexual arousal, where you might notice that it takes longer to reach an orgasm, or there's different sensitivity in your labia or clitoris, and that can certainly create some challenges. We also know that when you have been forced into a medically induced menopause, that the narrowing of the vaginal canal, which we call vaginal stenosis, can create painful intercourse, including some of the atrophy that the vaginal tissue can experience, similar to our skin, when you notice that your skin is just kind of looser or not as full. The same goes on with the vagina, the labia. And again, when we think about skin, the care of skin is really important, and we'll talk about that. We also know that mood is impacted by both the cancer diagnosis as well as the hormone depletion, and also that medications that we prescribe for mood, like SSRI, can also influence our interest or desire or orgasmic capabilities in many women. So something like Prozac might negatively influence your sexual function, but something like Wellbutrin would have less of an impact. So having a conversation with your doctor is also really important. We know that, again, there can be discomfort in intercourse, whether that is manual manipulation or intercourse itself. Again, the changes in the vaginal depth because of surgery can create painful intercourse. And so we're going to talk about, how do you get creative, and do you need to have vaginal penetration to have a satisfactory sex life? Do you need to have orgasm to have a satisfactory sex life? And I would say the answer is no. It's again about adapting expectations and being willing to explore other types of pleasure, connectedness, and intimacy. We also know that body image changes can be significant. Again, some women are not fazed by scars. They embrace them, they look into them and lean into them, and others, it's very scarring emotionally. So again, not changing or shaming or challenging that, just noticing it. And if that becomes an issue where your body image is getting in the way of you living into your life, that for you is an opportunity to seek out some professional help and begin to explore are there ways that you can enhance the way you feel about yourself. And we're going to talk about that a little later as well. When we talk about sexuality and sexual function, a lot of women will say to me, why didn't my doctor talk to me about this more directly? Now, I find in the ovarian cancer world that more and more physicians or nurse practitioners or nurses or social workers are addressing the issue of sexual function and sexual health more upfront just because of the disease itself being a sex organ. However, what we know is a lot of patients are more reluctant to ask the provider about sexual function because they're worried there isn't a solution or they don't want to embarrass their provider. And I would challenge you all today to really think about that and to think about how you might create a dialogue with the provider of trust, whether that's, again, a nurse, a social worker, your oncologist, or your surgeon, and how you can open up that conversation with them about what are the options to help improve your sexual function and or, again, your intimate relationships. When we think about the psychological or the physiological alterations in women, there are many, and we've already talked about them in previous conversations, the hormone alterations, right? We know that acute or premature ovarian failure can have a significant impact on the body and the sexual response. We know that the consequences of ovarian failure can go from both sexual function, but also things like osteoporosis, the hot flashes, mood changes, weight gain, which can influence not only our sexual body, but our feelings about our sexual body. And again, we've talked about the surgical changes, and that fatigue and decreased physical stamina is real. And I know it can last quite a long time. And when you don't have energy, the last thing on your mind typically is being sexually or physically intimate with yourself or with your partner. And so again, thinking about how you conserve your energy, if a priority is reconnecting with your sexual body, either by yourself or with a partner, prioritizing the storing of energy to be able to be physically intimate is going to be important. Additionally, thinking about the time of day, right? By about 5 o'clock, most of the people I work with are kind of exhausted. And so really thinking through, maybe it's the weekends during the middle of the day or a weekend, or maybe it's the morning. And it might mean that you and your partner or you and yourself need to adapt the time that you take time to intimately connect. But giving yourself permission to be flexible with that is really important. So low desire, oftentimes I hear from women that I don't have any desire and it's gone, right? I don't really even want to, I don't think about it, but they're coming to me in distress about that it's distressing to them that they don't have desire. And so if you're finding that you're distressed about having desire and you have desire to have desire, then you have desire. It just means your body may not be having the same triggers that it had before, right? When you think about desire, we often think about looking at our partner or looking at something that might turn us on or stimulate us and having a physical response. When we are thrown into menopause, whether it's gradually or acutely, that changes. We need to give our brain some things to think on, our body some things to feel before what we notice is that desire kick in. So our expectation that desire is going to come first related to a physical sensation needs to be altered. And we need to think about desire being in our brain, that we want to want it. We want to be close to our partner. We want to be close to ourselves. And we're going to take the steps needed to make those connections. Whether, again, it be carving time out for us to be intimate together, whether it be identifying a time of day where we are connecting. Again, low desire does not mean no desire, and saying I don't have much desire also doesn't mean you have no desire. And one of the best things you can do to address low desire is counseling and education. We know that both addressing the relationship issues, identifying where there might be a disconnect in expectations, because that does happen. Sometimes our partners don't realize the magnitude in which our bodies have changed. Sometimes our partners are being withdrawn and are worried about being physically intimate with us. And so we're interpreting that as they don't desire us anymore. And having a conversation with a professional or together about what the expectations are and how that might look are really important. Again, your body's going to look different. You may feel different when you find yourself being aroused. Your partner may notice that you give different signals, and it's really important to talk about that. One of the examples I have is oftentimes lubrication changes. And if your partner was used to that being a signal of you being aroused, a conversation is going to be really critical about that feels good. I enjoy that. Just because I'm not lubricating in the same way does not mean it doesn't feel good. Because oftentimes, again, they're looking for the cues that indicate it's pleasurable to you. And when your body isn't producing those same cues, it can be confusing if we don't talk about it. So we need to start with assessing our body and brain expectations. What is it that we expect up here? And put thoughts in here that allow us to feel stimulated, that allow us to put ourselves in situations where we might be able to engage in an intimate relationship. And remember, the most powerful sex organ is our brain. Putting thoughts, putting sexual thoughts, putting desires, putting thoughts around arousal in our head can influence the way our bodies respond to it. If up here we're saying, I can't, I won't, I shouldn't, your body's going to say, I can't, I won't, I shouldn't. So up here is where you have to start. Certainly, you always want to rule out any medical causes or contributions. Are there medications you're taking that are further exacerbating this? And is there an opportunity to change those? Is anxiety or depression or a low body image contributing to the low desire? And if so, again, that's where you want to go back to a physician, a trusted social worker, a therapist, and ask, can you help me work through the anxiety, depression, or some of the challenges I have related to my body? And certainly, if your partner has any other sexual dysfunctions, or you do, having a conversation with a sex therapist can be really important. We also know that cognitive behavioral therapy is so important when we think again about the thoughts we put up here. All of that can influence everything else in our day. So with I'll never be the same again, try changing that thought just a little, just pivot it a little to life will be different, but I have incredible strength to find new ways of satisfaction. Notice the difference, right? One is giving in, that it's never going to be the same. I can't do anything about it. The other is empowering. I have incredible strength to find new ways of finding satisfaction. When we talk again about the body's response, sometimes just getting ourselves to relax, doing a few deep breaths, noticing how our body feels. Oftentimes we disconnect from our body if there's pain or if there's shame or embarrassment, and really getting into our body, noticing how our body feels, taking a few deep breaths, noticing how our body responds to touch can be so critical in helping develop that strength and internal dialogue around, I can do this. And certainly if you're in a relationship, couples-based therapy is the most effective to address low desire and expectations within the relationship. We also think it's important when we're in a session doing sex therapy to talk about vaginal dryness and pain, because again, we know that ovarian cancer can create many of these symptoms just from the treatment itself. If you have painful intercourse, the first thing you need to do is talk to your physician and consider getting a referral to a pelvic floor therapist if you haven't. Pelvic floor therapists are trained physical therapists who their whole job is helping women or men regain control of that pelvic floor. And it can be so helpful in learning how to keep that pelvic floor strong, how to relax the muscles in the pelvic floor, because oftentimes pain with intercourse can be caused by those muscles being so tight, so learning how to relax them. Or seeing a pelvic floor physician who specializes again in pelvic pain. The other key piece of vaginal health is stretch, strengthening, and moisturizing. And there's a difference between moisturizer and lubrication, right? Lubrication is something you use to masturbate or for intercourse. Moisturizer is something you use on a regular basis, just like you do with your lotion. So if we think again about how we treat our body, when we get out of the shower, we usually apply lotion so it absorbs nicely and our skin stays more supple and moist. We want to do the same thing for the vulva, the vagina. So when we know that things have atrophied, what do? We go to the gym. We want to keep our muscles strong, right? We lift weights, small weights, multiple times, right? We want to build that strength up. We also know that we need to stretch our muscles, right? We need to keep them stretched so they're open and strong. And again, keeping them moist, keeping that skin moist. Again, the vulva and the vagina are not different from this. We need to keep that vulva stretched, strengthened, and moisturized. So using dilator therapy, which you can get from your either surgeon, radiation oncologist, or medical oncologist, or from a pelvic floor therapist, is a really important tool to use on a regular basis. Some women feel like, I don't want to keep doing this, but the reality is it's just like exercise. Sometimes for some women, it's going to be a lifelong commitment to doing that a couple times a week. And using that can be really important, along with a moisturizer that can be inserted into the vagina to keep that the tissue in the vagina, again, supple and elastic. Some women might use vitamin E. Some women use Good Clean Love. There are lots of lubricants out there, moisturizers out there that can help with your needs. We also know that keeping blood flow to the vaginal tissue is really important. So some women, if within their religious and cultural values, it's okay. Using a vibrator can help, again, with increasing blood flow. Blood flow is healing. We think about it as tissue reparation. So blood flow is really critical to the ongoing healing of that tissue. For some women, they might be able to use topical or systemic estrogen, but again, that would be a conversation between you and your physician. We also know there are some prescriptions now for women that, again, may or may not be appropriate, but there are some old antidepressants we've found to be helpful, like Addyi. Aspina helps with blood flow to the tissue. So again, increasing blood flow to the clitoris, to the labia, to increase sensitivity and the awareness of, again, libido. Mona Lisa or other laser type treatments is an intravaginal laser similar to microdermabrasion. It helps rebuild the collagen in the vaginal tissue and can be very helpful because it's non-hormonal and minimally invasive with very minimal side effects. Can be helpful for women with ovarian cancer, again, when you can't use hormone replacements. The other reality is just giving your body and self time to prolong foreplay is really important. Take time, don't rush. Give your body that time and the warm up it needs in order to feel that connection both to yourself and or your partner. Try for non-penetrative sexual activity, whether that's mutual masturbation, whether it's masturbation with yourself, again, within your own cultural and religious values. Maybe it's kissing and just going back to some of the basics of making out. That can be really fun. And sometimes we lose that when we've been in a long-term relationship. So getting back to some of those basics. And exploring with different positions. There is a book through the American Cancer Society that's also online, a PDF called Sexuality and the Woman with Cancer and Her Partner. And it has positions that you could try, different positions that might be helpful to you that maybe you hadn't thought about to limit penetration and or discomfort during intercourse. Again, if you are using penetrative intercourse. We know, as I said, masturbation or prolonged foreplay can be helpful, but staying very self-focused is also really critical. Getting to know your own body, getting comfortable with your own body is first and foremost of priority. If you can focus on the sensations of that feels good, that feels nice. If you can verbally affirm yourself and or your partner of that feels good when you do that, or that actually doesn't feel good, can you move your hand to the right, right? Giving that feedback is also really important. And wearing things that help you feel confident. If the scar on your abdomen is distracting for you, think about wearing crotchless panties or wearing a cami or something that makes you feel sensual. And again, how do we slow ourselves down enough to really give ourselves permission to explore? We've got to feel more relaxed. We've got to give ourselves time to just breathe, to connect to our body. And Sensate focus exercises is one of those tools where you focus not on sex. In fact, it's focused exactly on the opposite. It's not about sexual play. It's about just sensual touch, where you can do it to yourself, sensual touch for 5 to 10 minutes, and just notice what happens when with your body as you rub your hands softly and kindly around your chest, around your legs, avoiding any the breasts or the genitals, and just notice what it feels like to feel kind, good touch. You can do that with your partner as well, and then you can reverse roles and you do it to your partner. And just again, notice what it feels like. We also know that after Sensate focus exercises, there are some other things that you can do if you're still feeling like, ooh, I don't know how I feel about my body being touched. One, again, seek out the support of a therapist. Two is have a conversation with your partner, because sometimes they're so timid about touching you that Sensate focus exercises can really be a wonderful, permissive way to begin touching without the energy or focus or pressure of intercourse. There are many couples who resume doing Sensate focus exercises, mutual masturbation, and other types of intimate play that never resume necessarily intercourse and still have a very satisfactory sex life. One of the challenges is that we don't talk about it often, right? We're afraid to bring it up, or we're afraid we're going to hurt our partner's feelings. We have a trouble talking about how we're feeling related to our sex life. And our partners often feel guilty because they don't want us to feel like we're being pressured, or they're pressuring us, or that they're not happy. So that that conspiracy of silence continues to increase for many. And being able to talk about it can be so freeing. So maybe it's just with a conversation around fact, belief, feeling, and action. Something like, ever since my cancer diagnosis, I've noticed that you don't touch me as often. It makes me believe that you're afraid you're going to hurt me, or maybe you don't find me attractive. And that makes me feel sad that cancer has changed that aspect of our life. I would love it if you initiated touch more often, right? We just gave them something to do about it. Oftentimes, and I'll be kind of gender stereotype right now, women often go to the you didn't, you don't, you never, and we don't give our partners the opportunity to change that behavior. So we have to give them an action and then give them time to act on that action. Now the key is, when they act on that action, we can't say, you're only doing that because I told you to, right? We've got to give them permission to change and then be appreciative of that and take that as information that they love and care about us. So again, when we think about talking about it, it's not even just our partners, it's also our friends. Maybe you've noticed that your intimate relationships with your friends have changed. Talk about that in a way that's empowering to them. Gosh, I miss talking about things other than cancer. It feels like every question you have is about my treatment. I'd really love to be able to talk about you and what's going on in your life and how you're doing. It would be meaningful to me if you called and you didn't ask about cancer, and I'll tell you if there's anything you need to know related to that, right? So again, fact, belief, feeling, and an action. For the women with advanced disease, I know this is a different conversation. Because you are going to be on and off chemotherapy, the changes in your body are going to have a heightened recognition of loss, of kind of coming around the corner and feeling better again, and then having to do a new treatment. And I just want to acknowledge that. And that there's still so much life to be lived, including your sexual and intimate relationships. Certainly, again, you might need to identify that intimacy and connectedness and touch is much greater a need than sexual intercourse, and give yourself permission for that. Give yourself permission and your partner permission for that. If you need help at home, it's really important that you identify what is partner time, what is caregiver time, because oftentimes they get blurred together, and then we feel like our partner has become our caregiver and we're the one being cared for, rather than this is my equal partner. So decide what's partner time, when we can sit on the couch and snuggle and watch a movie or spend time talking over dinner, versus caregiver time. And what can you do on your own? What do you not need assistance with? Or potentially, what might you want someone else to help you with? Some people want their partner to be the one that helps them bathe or get out of the shower. And that can be an incredibly intimate time where you spend time talking, right? Being with each other can be incredibly intimate. If for you, it's interfering with your intimacy, maybe you need to think about identifying someone else who can help you with those activities. And certainly, again, fear of pain or side effects are a real thing for both you and your partner. So talking about that, knowing that when you have a good day, take advantage of it. And when you have a bad day, give yourself grace, give yourself kindness. What often happens with advanced diseases, our healthcare providers sometimes make the assumption that sex is no longer important to us and that there are other priorities at hand. But for some people, that sexual intimacy is life. And so if that is important to you, I encourage you, I challenge you to be brave enough to bring that forward to your provider to see if they can come up with some solutions that will help you move forward in your relationship. And as we transition the next 7 or so minutes, I wanted to highlight some some body image issues, because it's also a critical piece of our sexual self. Sexual function is really important, and it's important for many ways, right? We talked about the importance of stretch, strengthen, and lubrication or moisturizing. And that's not just for intercourse. That's also just in general for your overall health, right? It helps with incontinence, it helps with pain, it helps with more control. And should you want to be sexually intimate with penetration, it will help provide more comfort with that. But overall, even if you never have penetrative intercourse, the focus on maintaining the strength of the vulva, the vagina, is so important. And being willing to have conversations with your partner about what feels good and what doesn't, or with yourself of what feels good and what doesn't, is so important. Similarly, when our body image, when our feelings about ourselves get in the way, sometimes we're not willing to have those conversations with our partners, and we need to focus in first. So this statement of, dear body, please heal. I don't know how much of this I can take. I know I need to be patient, but please, I think is so honest and raw when we just get to that point of like, oh, my hair is just not growing fast enough, or why are you still feeling tired a year after treatment? And being gracious with oneself is so important. And then why we talk about it is because people experience changes in body image, right? That low evaluation of ourselves. And if it was important to us before, it's going to be important to us after. And sometimes I hear from women, I feel bad even worrying about like that's the last thing I should worry about. I feel, this immense sense of shame that I'm even worried about it. And what I'd again encourage you to do is think about yourself as just a human, right? That yes, of course, there are lots of important things in your life, but body image is a really important thing to many of us. We live in a society where there's high value on that. And so if that noise is in your head of, I'm really struggling with this, and then I feel bad that I'm struggling with that, again, extend some grace to yourself. It's really a normal thing to struggle with, and talking about it can really be helpful. We know that body image challenges are around femininity, around all the changes our bodies go through: weight gain, weight loss, stretch marks, fluid in our belly or in our legs, some of the disfigurement that cancer can lead to us, whether that's, again, from chemo or surgery. And then some of those behavioral challenges. If I can hide my cancer diagnosis, do I have to talk about it? Do I have to disclose? When I'm on a date, is it something I have to talk about right away because I can hide it? That can create a lot of worry about, when do I tell them? Before they see my scar or when they see my scar, right? And that can create some anxiety in and of itself. If you notice, though, that you're avoiding social situations, if you're avoiding and or responding to romantic relationships in a negative way, I would say that should raise a red flag to you. If you don't want to be touched, if you're pushing people away, notice that. If you're worried about somebody looking at you and asking a question about the wig or the hair changes or the scars, and it's actually creating a negative reaction where you don't want to interact with people, I would say it's time to seek out some professional help and have a conversation about that so you can get back to living. We also know that there are certain risk factors, right, for negative body image. When we have unrealistic expectations and we think everything's going to be back to normal and look the same, that can be really challenging and create a whole host of reactions of frustration and depression and shame and other really kind of icky feelings that we also, again, might have the opportunity to talk to a professional about. When we are just highly dissatisfied with our appearance, after the following of surgery or chemotherapy, and it's all we think about, that again is an opportunity to just take notice, not to shame or be embarrassed that that's what you're thinking about, but to take that as an opportunity to go and talk to a professional, because clearly there's some opportunity to really think about, what are your priorities, what's important to you, how can you reclaim your body and feel good about it in spite of the changes that it's experienced. When we think about how we build sexual and self-esteem, certainly, as we talked about earlier, that brain stuff is so important. What we put in here is more critical than anything else. So there are a few tips and tricks that I like to talk about. One, just starting with the basics. Find 3 things that you like about yourself in the mirror every morning, starting with an affirmation. Oh, like, I notice even though my hair is different, maybe it's gray or it's curly, my eyes are still the same. When I smile, they light up in the same way. When I put my lipstick on, my face lights up, right? Find something that you like about yourself. 3 things, positive things. Give yourself positive affirmations. And for some, I say, if you can't think of it, write them up and stick them on a sticky note on your mirror so that it's the first thing you look at every day rather than, oh, I look like that again, right? That's the way we start our morning. Think of how that carries in your weight in your body throughout the day. What if you said something like, I accept my body. I will do everything I can to love and help it heal. And if you're not there yet, how about I'm working to accept my body. I will do everything I can to love and help it heal, right? Some of it also is just supporting your new limitations. You might need to communicate this to the people at work, to your partner, to your friends, that today is a good day. And I'm going to do everything I can to make sure that I use the energy in the way that I can today. That's good for me and good for us. Tomorrow may look different. And that is a normal part of the healing journey. We also know that taking time out for ourselves is so important. Things have changed, and we can't expect it to feel the same. They've changed, right? Even if that change is positive, it's changed. So taking time to get to know your body. What's your stamina like? What does it feel like? How does it feel to sit? How does it feel to stand, right? How does it feel to lay down? How does it feel to run? All of those things are really important. What does and doesn't feel good? Same with Sensate focus exercises. What does and doesn't feel good? And make sure you're communicating that. When you are doing activities that connect to your body, you're helping yourself feel stronger and better. And some of those are just movement, not necessarily exercise, just movement. It can be taking a walk. It can be yoga. It can be gentle stretches. It can be sitting and just breathing, right? Those are things that are connecting yourself to your body. And certainly the people that you surround yourself with are so important in their contribution to your strong self and or weak in self-esteem, because people can influence us, and they do. And when people are negative, it takes its toll. So take the opportunity to assess. And are there people around you who are bringing you down? And maybe it's time to put a pause on those relationships or reevaluate them. The other piece that we like to talk about is control, right? I am a self-professed control freak. I think and believe I can control everything. And sometimes I have to put myself in my place and remember I can only control a few things: what I think and how I respond to the things around me, right? So if something's brought to me, I can control how I respond. That thought may not be something that I control initially, but I can control how I respond to it. So if my first thought is, ugh, you look like that again, I can control what I do next. I can go with that thought, or I can offer a different thought and challenge it. So our beliefs and our actions, we actually do have control over most of the time. One of the other challenges that we often hear in the therapeutic world is this negative messaging. And I often say to women, you know, is that message really true? Are you not attractive? Are you not sexual now? And if it's a negative message to yourself, would you say that to someone else? And if not, why do you keep saying it to yourself? Are there not options that you can, when you notice it, offer yourself something else, right? Like, wow, that was a powerful negative message. I am good, I am kind, I am strong, I can change how I think, giving myself the empowerment to shift that. And if I really get stuck, lean on someone that I know I trust, right? Do you have someone in your life that you can do that reality check with, who could offer you that the fact that you think you've gained 45 pounds, even though the scale says you gained 10, I don't see 45 pounds, right? Get that reality check with someone you trust and love. And again, when we think about what we have control over, we have control over this check-in with ourselves. How am I feeling? What do I need to do to change how I'm feeling? So what's not working? What is working? And what do I need to make it work, right? So it's not working for me getting up and exercising because I'm too fatigued. Oh, okay, maybe I need to give myself some time to wake up. Maybe I need a cup of coffee. Maybe I need to adjust the time of day that I work out, right? Or what do I need to be successful? I need a friend. I need a walking buddy. Great, put it in place. What are you proud of? What can I let go of? Those are really important questions to ask yourself on a regular basis when you feel yourself stuck or looping. We know relationships are hard, right? They contribute to so many things, and they're hard enough before cancer. Sexual relationships, intimate relationships, and friendships are hard enough before cancer. So going back to that tried and true, communication is so important. Stating a fact, belief, feeling, and action can really help open up conversations, because oftentimes what I find is the partners or friends were responding out of what they thought was right, and they didn't know how it was hurting you, and they just need some information on how they can do it better. When you think about being intimate in a relationship, make choices that enhance your desire, right? What are you wearing? What do you feel sexy or confident in? What are the things you can put around you? Candles, smells, touch, sensations that help improve you feeling that desire. One of the most important things is to start thinking about it early and often, so that when you are ready to be sexually intimate with your partner, your body has already been thinking about it, right? Because as we think about it more and more, as we fantasize, as we bring in images that allow us to think about the thing we want, we desire it more. So give yourself permission to do that. I think the other important thing is to remember that our partners and friends are going to have their own feelings, and we have to give them permission to feel that. That doesn't mean we have to own them. It doesn't mean we have to carry them. And it doesn't even mean that we necessarily have to accept them, but we need to give each of ourselves permission to have our own experiences, our own losses, our own griefs, and our own feelings about this process. Yours are just as important, right? And yours are yours, but our partners also may have their own. If you find yourself stuck, I would really encourage you to connect with a therapist. Association of Oncology Social Workers has a list. There may be a list within Psychology Today or your insurance plan. There may be one in your cancer center. But connecting to a therapist can be so critical through this process. One of the most important things as we begin to wrap up our time together is focusing on joy, right? Joy is different for everyone, but maintaining joy is so important while life is so uncertain, and more so now in the midst of this pandemic. There is a lot of uncertainty, and taking those joyful moments is so hard. And that doesn't mean being unrealistically happy. There's a difference. It's okay to grieve and redefine what is good for you. When we hear somebody say, like, nothing's guaranteed, or you could get hit by a bus, right? Those are not helpful statements, and it's really important that you let them know. That's not helpful. What is helpful is when you say, I'm with this, I'm in this with you, and I need your support in this. Find things that make me laugh. Come and be part of my healing. Right? And it also offers an opportunity to seek change and seek the things that fill you up. Cancer is a great excuse to reprioritize. Nobody's going to question you while you're doing that. So seek out the thing that brings you joy. What fills you up? That's that joy, right? It doesn't have to be blindly happy. It's what fills you up and gives you that contentment. I love this quote about coping. When we think about successful coping is not about having a positive outlook or striving for a cheery disposition, right? Rather, studies show that coping in a way that's familiar to you can help. In essence, people with cancer should be encouraged to develop realistic expectations about their illness so they can make good decisions about their care and not be pressured to be blindly positive. And I put this in here because sometimes I feel like there's this internal pressure and this external pressure to just embrace it and go with it. Or cancer, I think of some of these, what a lot of my young adult population calls like these super cancer survivors, where they're like now climbing Mount Kilimanjaro and doing all these crazy things. And there's this internal pressure of like, do I have to do that because of cancer? No, right? There's just an opportunity to cope with life in the ways that you do best, but to seek opportunities that bring you joy. Because a person with true hope will experience a wide range of negative and positive emotions, yet through all the difficulties will continue to move forward in life. And I love that quote. It is so important that with true hope, it doesn't mean that you're blindly optimistic or that you're always happy, right? You're going to have a lot of experiences, a lot of feelings, but you're going to keep moving forward. Finally, as we summarize some of the information here today, remembering our brain is the most important sex organ, our skin is the largest, and you have a lot of skin that is not affected by this cancer diagnosis. And confidence in yourself can be so sexy. For yourself or to a partner or partners can be very confident, can be very sexy. And I want to end with this statement because I think this is so powerful. Dear body, I wasn't always happy with you. I wanted longer legs, a flatter tummy, firmer arms, but recently we've been through a lot, you and I. We faced cancer together. We lost our right breast, our hair fell out, but we got through it. And now I've learned to love and accept you for what you are. Not perfect, but beautifully imperfect. You are my body, and I'm proud of you. I know for many of you, this may be a hard pill to swallow right now. This statement may be hard, but maybe you can find a few things in there that ring true for you. Maybe you can take a few moments to just start being gracious and kind rather than being angry at your body. Find ways to encourage it. Rather than being frustrated with your body, find ways to nurture it. And the same goes with your relationships. Rather than being angry with them, find ways to give grace and open conversation. Rather than being frustrated, again, find opportunities for conversation around how to improve it. Cancer certainly changes our life, and it changes our sexual bodies in tremendous ways. But there are lots and lots of ways to continue to work around them, and lots of ways to continue to work around the challenges with our body image. I'm so grateful that you took time to be here today, and look forward to one day being in person again. Thank you so much.